guys, wonderful day here at ESPN Central. We're going to be discussing the ulnar collateral ligament surgery, aka the Tommy John ligament surgery.
Good evening all. Like Ugo said, we will be talking about the ulnar collateral ligament surgery and where it originated from. The name Tommy John is actually comes from the Dodgers pitcher who underwent this surgery in 1974. This specific procedure usually affects baseball players because of the velocity that they throw at. Ulnar collateral reconstruction is a surgical operation in which the ligament of the medial elbow is replaced with a tendon from the hamstrings or the forearm.
Efi, so where does this injury occur and what symptoms occur that lead to the development of the injury?
Okay. So this injury usually occurs in baseball players, but it can also happen to tennis players, football players, gymnastics, soccer players, and softball players. But for today's topic, we will just focus on baseball players. The ulnar collateral injury develops in the UCL. It's basically a repetitive stress to the elbow or from trauma. Throwers are more at risk because throwing motions that twist and bend the elbow put extreme stress on the ligaments. Over time, the ulnar collateral ligament develops tiny or large tears. The ligament stretches and lengthens and gets to a point where it can't hold the bones tightly enough during throwing activities. Symptoms include the pain on the inside of the elbow, looseness or instability in the elbow, irritation of ulnar nerve, and decreased ability to throw an object. So, Ugo, what biomechanically causes a UCL injury?
Well, first, we brought in a pitcher from the Milwaukee Brewers to demonstrate the natural baseball pitching throwing motion. Well, first of all, ligament damage, ideally in the throwing arm, is a very complex process. Studies show that the curved ball has a greater stress on the shoulder and the slider throw has a greater stress on the elbow area. However, the quantity of pitches is the greatest effect leading to this injury. Some players who have poor mechanics who throw long distances may never experience any ligament tears. However, others with superb mechanics may experience plenty of these tears or injuries related to the UCL injury. This means that this injury varies from person to person, and one cannot simply determine this injury based off the risk factors. To obtain as much biomechanical information as possible regarding this injury, subjects are usually attached to a multiple sensor room and placed in a dark pitch room the size of a tennis court, and are given baseball containing sensors and are asked to conduct a series of throws beginning with a warm-up of their normal throwing motion, then leading to different variations of throws like fastballs and curveballs, and multiple attempts to provide a more in-depth biomechanical analysis. The elbow is just one segment involved in the kinetic change of pitching. The shoulder muscles, the core trunk muscles, and the forearm and hand all contribute cohesively in such pitching motion. And problem appears in this kinetic chain can cause influences, increased stress on the elbow area, leading to the Tommy John injury. When compared to pitchers throwing at similar velocities, overall max torque measured in Newton meters in the focal point is what determines such injury. However, the stress-strain relationship must be taken into deep consideration here. The amount of torque placed on one's UCL is the ultimate factor, since a pitcher who places much less stress on the elbow than others may be less susceptible to the injury. To go in more in depth, using the subject's height and weight software from the pitching analysis conducted, joint angles, torque, and internal and external rotational forces can all precisely be calculated, as well as improvements that can be made to decrease this UCL injury. Results show that a major biomechanical prescription that can be made from the computer analysis conducted to fix such problem is to alter the pitcher's release point from the initial throw. A major biomechanical prescription that can be made is to adjust the pitcher's arm angle either more upwards or downwards, depending on the size of the pitcher. So, Ify, how does one get diagnosed with this injury?
So doctors can diagnose ulnar collateral injury through a history of physical examination. This physical examination includes x-rays and MRIs. So how does one recover from this injury, Larissa?
All right. Recovery is pretty basic when it comes to this UCL injury. For the first phase, they wear a splint for about 7 to 10 days. From there, they gently start to participate in range of motion exercises to rehabilitate the area. And also, they are required to wear a brace until they regain full motion in the elbow joint. Phase two is 6 weeks after the surgery, and one must begin to perform elbow strengthening exercises. Of course, you have to consider the pain levels. If they are not at that point, you step back. There's no need to rush through the recovery process because it's the most vital. For at least 4 months, the patient must be advised against overstressing the area, so no competitive play is allowed whatsoever. Phase 3, which is the final phase, happens 4 to 5 months after the surgery, and the athlete is now able to toss the ball without a wind-up motion. After 6 months, the athlete may start using an easy wind-up when throwing the ball, just getting the range of motion back together. After 7 months, the baseball pitchers are allowed to return to the mound. After 9 months, most pitchers are completely rehabilitated and are able to perform at a competitive level. Some studies have shown that after this UCL reconstruction, some pitchers actually have a stronger pitching arm than they did before, just due to the overload of the rehabilitation exercises. So, Michaela, what can be done to prevent this injury from happening?
Today I have 7 ways to prevent Tommy John injury. The first one is preseason conditioning for your shoulder. Many of you are questioning why the shoulder, because we all know it's an elbow injury, but without strengthening your shoulder and scapula, it will cause overload stress onto your elbow, and you need to have strength so you don't end up with that injury. The next one is when you're trying to throw too hard. I know a lot of people, all they do is go out there and they try to throw really hard to show, but really you need to ditch the radar gun and focus on your form and motion before you try to gain your velocity. The third one is you must warm up, and you must warm up and warm up. You first need to start with a full body warm up and get your body warm. One way to know that you are warm is if your body is sweating. Once you've started sweating, you can now progress to a shoulder and elbow warm up. Throughout stretches of your shoulder and elbow, you then can start with a short toss with your partner, and then you progress to a long-term toss, and then to a 50% velocity pitch. And once you've done that, you can then go on to a full-length pitch. The next one is you must ditch the curveball. Many people don't realize the force that the curveball pitch puts on your elbow, but it can be really dangerous to your UCL. If many of y'all probably don't even know what a curveball is, but a curveball is a pitch thrown that has a strong downward spin, causing the ball to drop right over the plate. When forcing your elbow and hand into that position, it puts major stress onto the UCL and growth plates, and perfect form is very rare. If you do not have perfect form for this pitch, like I said, it puts major stress on your elbow and could cause you to end up on the surgery table and the doctor's performing Tommy John surgery. Next is to use a pitch count. You need to use a pitch count to protect your arm, just because you do not want to end up overthrowing and ending up having Tommy John surgery. With a pitch count, this can protect the athlete and allow for your coach and trainer to make sure that you are not going over the traditional count. Many pitchers like to stay around 80 pitch count per inning or per outing, but it just depends if you are a starter, reliever, or closer. And the last prevention is don't ignore the signs. If you have signs of Tommy John, please don't ignore it, because you will end up having a full-blown Tommy John injury instead of just a partial tear, and your recovery could end up even longer. Also, if you are in the recovery stage and you are still having signs and symptoms like numbness, tingling, or pain and weakness in the elbow, please be sure to inform your doctor or trainer, because you could end up right back where you started right before the injury.
Well, guys, that's all we have for you guys today. We thank you for viewing. This concludes our segment for the Tommy John injury, aka the ulnar collateral ligament surgery.